Vital signs. Vital signs include blood pressure, pulse, respirations, temperature, and nurses ask the client about pain. The first one that is going to be discussed is blood pressure. This is a measurement of the amount of pressure that is exerted by the blood when it is flowing through an artery. So the top number of the blood pressure reading is the systolic blood pressure. This is the maximum pressure that is exerted with a heart contraction that forces the blood into the aorta. This is also known as systole. Diastolic blood pressure is the minimum amount of pressure when the heart relaxes. Diastole. The cardiac output is the amount of blood that is pumped into the circulatory system within 1 minute. That is why a nurse, when taking an apical pulse, listens for 1 full minute to the lower aspect of the heart. The cardiac output is a product of stroke volume and the pulse rate of the heart. The stroke volume is the amount of blood that is ejected by the left ventricle during one contraction. If there is an increase in cardiac output, this will cause an increase in the blood pressure, or the amount of pressure exerted when the left ventricle pumps blood into the aorta. Decrease in cardiac output will cause a decrease in the blood pressure. Peripheral vascular resistance. This is the ability of vessels to accommodate the increased blood flow without increasing the resistance or the blood pressure. Contractility. This is the heart's ability to contract efficiently. This is indicated on a result by an ejection fraction. This is the percentage of blood that is ejected with each contraction of the ventricle. When taking a blood pressure reading, when the nurse is deflating the sphygmomanometer, the nurse is auscultating Korsakoff sounds over the brachial artery. The manometer reading is the point where you first hear the Korsakoff sound. That is the systole or systolic blood pressure reading. When the Korsakoff sounds are no longer audible, meaning you can no longer hear the Korsakoff sounds, this is considered as diastole or diastolic pressure. Blood pressure is affected by both intrinsic and extrinsic factors. Intrinsic, those are inside of the individual. These are not modifiable, nothing can be changed. Intrinsic factors are age, ethnicity, genetics, and natural hormone variations. Extrinsic factors, these may be modifiable. Examples would be one's weight, use of stimulants, medication use, amount of sodium or salt intake, amount of stress or anxiety on the body, and the activity level, whether one is sedentary or one is extremely active. Hypertension is classified into 4 stages: prehypertension, stage 1 hypertension, stage 2 hypertension, and hypertensive crisis. Prehypertension, systolic is 120 to 129 and diastolic is less than 80. Stage 1 hypertension, systolic pressure is 130 to 139, or the diastolic pressure is 80 to 89. Stage 2 hypertension, systolic pressure is 140 or greater, or the diastolic pressure is greater than 90 millimeters of mercury. A hypertensive crisis, the systolic pressure is greater than 180 millimeters of mercury, or the diastolic pressure is greater than 120 millimeters of mercury. Hypotension, the blood pressure has fallen below the expected range for the individual. There are various factors that can help determine blood pressure. Dehydration, that would decrease the amount of blood volume. Blood loss. Shock, a significant illness, or sepsis. Signs and symptoms of hypotension include dizziness, nausea, blurred vision, increased pain, and fatigue. Orthostatic hypotension is a drop in blood pressure when the individual is rising to sitting or standing position. This can be due to severe dehydration, hypotension, heart failure, disorder of the central nervous system. When a nurse assesses orthostatic hypotension, the blood pressure will be taken when the individual is lying, the individual is sitting, and the individual is standing. The sinoatrial node, or the SA node, this is the intrinsic pacemaker of the heart. This is a specific heartbeat for the individual. Tachycardia is a pulse that is greater than 100 beats per minute. Tachycardia can often be due to exercise, anxiety, medications, caffeine, nicotine, or some abnormality in the central nervous system. Bradycardia, this is when the pulse is less than 60 beats per minute. If you have an Olympic athlete, this would be an expected finding. Individuals that are not physically fit, a decrease in pulse rate may cause dizziness, fatigue, shortness of breath, chest pain, or confusion. The apical pulse is a point that lies over the apex of the heart. This is at the left mid-clavicular line and at the fifth intercostal space left mid-clavicular line. the nurse will hear two distinct heart sounds, S1 and S2. S1 is a dull, low-pitched lub, and S2 is shorter, it's higher pitched, and it is a dub sound. When obtaining an individual's pulse rate, commonly the radial pulse is the site that is used most often to palpate and actually feel the pulse rate. An apical pulse rate needs to be obtained whenever the client has a medication that regulates the heart rate. The nurse will also consider the pulse deficit. The pulse deficit is the difference between the apical pulse and the radial pulse in 1 minute. A pulse deficit is caused from an aortic rupture, coronary artery disease, or atrial fibrillation. The core temperature of an individual's body is the temperature of deep body tissues. There is a very narrow expected range. It would be 36 to 38 degrees Celsius, 96.8 to 100.4 degrees Fahrenheit. This will fluctuate throughout an individual's day. The lowest temperature is in the morning, and the highest temperature is in the afternoon. The body maintains constant temperature through methods such as shivering, sweating, vasoconstriction, or vasodilation. The body produces heat through the basic metabolic processes, any physical activity, or shivering. The body will lose heat through conduction. This is the loss of heat that is due to direct contact with a cooler surface. It may also lose heat through convection. Convection is the loss of heat due to air currents, like having a fan blowing on you. Evaporation is the third way the body loses heat. Evaporation is the loss of heat through gases from the lungs or drying of the sweat. And the fourth and last way the body loses heat is through radiation. Radiation is the loss of heat due to indirect contact with or being close to a cooler surface. Hyperthermia is an extreme temperature increase that is due to the inability to stop the heat production or stimulate heat loss. This can be a crisis and due to the inability of the hypothalamus to maintain the regulation of body heat. Hypothermia is a decrease in core body temperature. Hypothermia is often due to exposure to the cold or the inability to produce heat. The early signs and symptoms for hypothermia include shivering, decreased motor skills, and impaired peripheral perfusion. Inspiration is the intake of air into the lungs. This helps oxygenate the body tissues and support cellular function. Oxygen that enters during inspiration is transported through the bronchi and the bronchioles into the lungs to the alveoli. Here, this is where gas exchange occurs. This is through diffusion between the alveoli air and pulmonary arteries. Carbon dioxide, which is a waste product for the body, is expelled from the lungs during expiration. An individual with altered respiratory status or an individual that is ill, the nurse should assess the respirations for 1 full minute. Tachypnea is an expected then higher range. The routine range for respirations is 12 to 20 breaths per minute. If a patient is experiencing tachypnea, the nurse may also notice shallow respirations. Bradypnea is lower than the expected range of 12 breaths per minute. This individual may experience dizziness, fatigue, weakness, confusion, or even impaired coordination. Apnea is a total cessation or stopping of respirations. This can often be due to opioid toxicity, trauma to the body, or neurologic dysfunction. Cheyne-Stokes respirations are very distinct. These are irregular respirations, and it is a cycling pattern of breaths. These breaths will range from very shallow to very deep. They can be followed by periods of hyperventilation and then by an episode of apnea or no breathing at all. Kussmaul's respirations. These have a regular rhythm, but these breaths are abnormally deep and rapid. This may be exhibited as labored breathing or respiratory distress.